India is often called as the diabetes capital of the world. Despite growing awareness, preventive healthcare remains underutilized, as you know. So, why do you think people still seek medical help only when symptoms get severe?
It's also a cultural and a systemic issue. And also, it's the lack of screening on a large base. When you talk about diabetes evolves over 10-15 years. But before that, there's pre-diabetes. And before that, there's rising rates of fasting glucose. So the earlier you pick up your biomarkers, your blood biomarkers, and you see a trend of rising insulin levels, it's very clear that you are headed in the direction where you're going to get pre-diabetes or diabetes. Unfortunately, 50% of the cases of pre-diabetes are undiagnosed because people are not aware of it, people don't know what to do about it, and people don't want to get tested. With that, brings us back to, instead of disease care, when you actually have disease, you have to shift to a proactive model of preventive healthcare.
Do you also think that there should be major shift in lifestyle practices as well?
It was lifestyle earlier. Lifestyle just meant three things. It meant diet, exercise, and probably sleep. Now it's lifestyle plus. You also incorporate the quality, duration of sleep, stress management, kind of exercise you need to do. How many minutes must you have a week, and the importance of strength training, importance of keeping your muscles intact, because suddenly after 30-40 your muscle mass starts going down, and that is something that adds to the process of disease. Then screen time, mobile phones, mindful eating, sitting together and eating and spending at least 15-20 minutes over lunch is a better option than just gulping down pizza and burgers in the next 5 minutes. Unless you take out time for yourself, then time's not going to wait for you, and disease is something that's always around the corner.
Welcome to the OneHealth Conversation, a podcast series powered by Pacific OneHealth, where we bring together leading voices in healthcare to discuss latest trends, innovations, and smarter ways to manage health. Tune in for insights that matter, because better health begins with better conversations. I'm your host Vigya, and in today's episode, Preventive Care and Chronic Disease Management, the Micro-Hospital Advantage, we are taking a closer look at how we can better manage chronic and metabolic diseases like diabetes and hypertension, conditions that are reshaping modern healthcare. Joining me is Dr. Aijaz Ilmi, a distinguished consulting physician with over 30 years of experience in internal medicine and chronic disease management. He has been at the forefront of redefining patient-centered healthcare in India, emphasizing early intervention, lifestyle medicine, and integrated community-based models. In this conversation, we'll discuss why preventive healthcare remain underutilized, how micro-hospitals are transforming accessibility and trust, and what next decade of chronic care looks like. Dr. Ilmi, welcome to the podcast.
Thank you, Vigya.
We are so glad to have you here. So in the very first segment of this podcast, we're going to discuss about the importance of preventive healthcare. India is often called as the diabetes capital of the world. Despite growing awareness, preventive healthcare remains underutilized, as you know. So why do you think people still seek medical help only when symptoms get severe?
Well, it's also a cultural and a systemic issue. And also, it's the lack of screening on a large base. When you talk about diabetes evolves over 10-15 years. But before that, there's pre-diabetes. And before that, there's rising rates of fasting glucose. So the earlier you pick up your biomarkers, your blood biomarkers, and you see a trend of rising fasting blood glucose or rising insulin levels, it's very clear that you are headed in the direction where you're going to get pre-diabetes or diabetes. And unfortunately, 50% of the cases of pre-diabetes are undiagnosed because people are not aware of it, people don't know what to do about it, and people don't want to get tested. With that, brings us back to, instead of disease care, when you actually have disease, you have to shift to a proactive model of preventive healthcare where you can actually go to microscopic hospitals or mid-sized hospitals or wherever you're comfortable and get your blood biomarkers done. Not at 30, 40, 50, because disease is coming much earlier. You'll be surprised. I mean, you look at the AIM study on urban schools in the National Capital Region. Every fourth child is now suffering from rising blood sugar levels, beginning with liver disease, non-alcoholic fatty liver, and progressing on to early onset cardiac disease. So, and obviously, the relationship of mankind today has changed dramatically in the last 20 decades because the food has changed dramatically. Unless you go from instead of a reactive mode to say that, okay, I'm not feeling well, you go into a proactive mode and get into preventative mode and be consistent with that, we are going to have this problem increasing in the years to come. And early onset diseases has become the new norm. What used to happen at 50, 60 is happening now at 20, 30. So we need to protect ourselves, protect the community, and understand it's got large implications on the public health system and the cost and the it's going to be economic strain, because as you get disease earlier, the disease burden increases and the cost of treatment and cure also adds up to the country's economy.
That's an insightful point, Dr. Ilmi. Prevention truly demands shift in both mindset and as well as in system design. You mentioned early intervention and awareness, which brings me to this. Over 100 million Indians are diabetic and 136 million are pre-diabetic. What does this say about our current approach to early detection and annual health checkups?
Well, Vigya, what you mentioned, the numbers of 100 million and 136 million, I would say the number is much larger because more than 50% of the cases are undiagnosed because they haven't got their screening done. They haven't got the screening done, so we don't really know the exact number. It's likely to be much higher. In actual practice, as a clinician and as a physician, when you find a lot of youngsters with rising trends of fasting glucose levels and rising trends of fasting insulin levels. So both these combined with certain indexes give you an indication which show that you are getting predisposed to impending pre-diabetes and therefore diabetes over the course of the next 5-7 years. So if you can catch it early by early screening, then you've done yourself a favor, you've done public health a favor, and you actually get to know what's causing it. Then after that comes the implications of what changes you need to incorporate, right from nutrition, food, exercise, and sleep, your societal interactions. There are a whole gamut of factors which contribute to disease and early disease. So you need to be informed, made aware, and this is the entire motto where Pacific OneHealth, the entire idea is to empower the community that you need to be the CEO of your own health, ultimately, because your life matters and therefore everything else matters to the society.
But many people still hesitate to visit a doctor until something is, very serious. Would you say that delay is more about cultural habits or more about barriers like access and affordability?
I think it's a combination of both these things because culturally we are reticent to see doctors unless you got pain, fatigue, brain fog, or you're showing signs of slowing down. But in this fast-moving world, we are literally living in a fast-moving world where you can order food in 10 to 20 minutes time. It's called the Swiggy-Zomato syndrome or the Blinkit syndrome. So easy access to packaged ultra-processed food is going to be the bane, and it is the bane. I see far many more youngsters today with metabolic dysfunctions than people who are parents of the Gen Z generation. The Gen Z generation and school children are the ones who are actually, and they are the future. They are the working class and the emerging leaders of technology, science, and IT and everything is the younger generation. So if they're going to be compromised in basic health and they're going to show signs of metabolic dysfunctions, that means they're not able to perform to the full capacity. So we lose out on the soft skills of empowerment, economy, and everything else. So, which is why it's very important to get these screening tests done. Reach out. In fact, you should have mobile vans doing random screening with permission of school authorities also. You can identify based on BMI and non-BMI interventions. It can be done easily. It's being done in the West now, where they're revamping entire availability of food and they're being made aware and classes are done. In fact, in medical school, let's say 35 years ago when I passed out, we didn't know what nutrition was all about. We just knew that there's macronutrients and micronutrients, but the importance of that. Today, it's very evident at least 60% of youngsters and 50% of people above the age of 30 are depleted in micronutrients. It's called the trifecta. They'll have low serum iron, so therefore your hemoglobin is affected. Your blood picture changes, so you can pick up these signals by a detailed examination. Secondly, the trifecta, the second part is very low vitamin D. Now, vitamin D is not only just a vitamin, it's a hormone, and it's something that controls and it contributes to your entire digestion, your immunity, your gut-brain axis, which is why it's very important to know these levels. And don't go by the reference ranges alone. You see 30, it says sufficient. In my fact, it's suboptimal. You need to be optimal. You need to be at a high level, because what you're facing is immense pollution in the NCR. You're facing pollutions elsewhere. You're faced with environment toxins which we are not even aware of. There are things called forever chemicals which are there used as fertilizers. In fact, in the makeup industry, the amount of parabens used and the BPH used is causing endocrine disruption. So you have younger and younger people, especially women, who are suffering from autoimmune disorders like autoimmune disorder of thyroid, lupus, early onset of arthritis. Unless you think and integrate all these things backward, you're fighting a losing battle. So the only way ahead is precision-based technology, early screening, and continuous care, and being responsible for yourself. I always tell my patients that it's a shared responsibility. My side is my clinical expertise, my ability to interact and give you time. And your side, your shared responsibility is being aware that you need to get better, and you are already on the path of impending diseases which is around the corner.
Absolutely. So the patient also plays a very proactive role in their own health. So moving on, addressing both awareness and accessibility seems essential, as you mentioned. Now we're going to talk about the challenges of chronic disease management. How can preventive strategies and chronic disease management work together to reduce hospitalizations and improve longer-term outcomes?
I always tell my friends and colleagues that this is one of the worst times to live, and this is also one of the best times to live. The worst times to live is because of processed food industry, the modern industrial dairy complex which controls dairy and food, rising gluten allergies, environment toxins, polluted air, lack of sleep, extreme stress. All this is contributing to early onset disease and chronic disease. And why I say best of times, because there's so much happening globally in terms of genome sequencing, in terms of liquid biopsies to prevent early onset cancers, to stop them from spreading elsewhere. So there's so much interesting stuff happening in the next 2, 4, 5 years that one has to be alive and healthy to reap the benefits of scientific advancement which are taking rapidly. And the price of all these things is coming down rapidly even in the West. So the idea is you're going to have situations where you can modulate your immune cells to target specific cancers. It's already started, and it's just going to increase rapidly. So your immunological resilience can be used to target cancer itself through CRISPR or the CAR technology. All this is happening around the corner, but obviously you can't substitute screening, early onset, picking up trends. These things will go a very, very long way, which is why the combination of trust, technology, being tech-enabled, and looking at what's happening globally, doing like at the Pacific OneHealth, we intend to reach out to various global premier institutions like Stanford, Cleveland Clinic, and others to understand how they're actually doing it, because when you watch and you listen to people, you understand the cost factors coming down. It's going to be more accessible, affordable, and therefore one should integrate all these things into a system which can provide the best for all patients of all ages.
So we're moving on to the next segment, Dr. Ilmi, which majorly talks about the micro-hospitals and redefining access and continuity. So large tertiary hospitals often focus on acute care, making follow-ups and preventive care a little difficult. How do micro-hospitals bridge this gap?
Well, I think it's the time of micro-hospitals or mid-sized hospitals which are community-centric and patient-centric and focusing on preventive healthcare and chronic welfare management is the time is now. is because large tertiary hospitals, the patient also gets overawed. There are probably longer queues, longer waiting time, and you normally go there in emergency. So why should you go there in an emergency when you can have a system of preventive and chronic wellness management to prevent from the situation of actually getting into an acute disease situation and getting hospitalized? And that is the economic cost. Let's not forget that we have a large middle class population, and there are a lot of people can't afford tertiary hospitals. So how to prevent hospitalizations? Don't let them get to the acute phase of disease which is rampaging, and there's no substitute to preventing it, stalling it, trying to reverse it, and maybe let it go into remission. Now there are a lot of doctors who are understanding that medicines alone may not be sufficient. Your relationship with food, nutrition, diet, sleep, exercise, stress, all these things play an important role in mitigating factors which can cause disease to spread rapidly. So idea is to slow it down, stall it, maybe prevent it, maybe get into remission, so the person actually gets relief. You need to be free of fatigue, pain, brain fog, various things. But unless you look at the blood biomarkers and do a detailed body metric analysis, your height, weight, blood pressure, your central adiposity, your mid-waist circumference, you can get signals that what is happening to an individual, and you can actually help patients, which is something a lot of clinicians and physicians are now focusing on.
How early can one get these detections done? I mean, tests and
You'll be surprised that the All India Institute of Medical Sciences, the most premier institute, did a study of NCR schools, and with basic testing of blood sugar, blood pressure, mid-waist circumference, and biomarker readings. And their study indicated that up to every fourth child from the age of 6 to 19, that is school-going children and young adolescents, what they're facing is every fourth child is partially or totally metabolically dysfunctional. They're being overweight, obesity, wearing glasses early, being difficult in school, having sugar crashes, rushing to school, with parents obviously a working class, and not being made aware the complete lack of fiber in their diets, the usage of refined starches, added sugars, sugary drinks, and packaged foods. This is all creating metabolic havoc. It's starting at 6 onwards. So this is what the AIM studies talks about. A lot of us have lived a lot of good years in our life, but it's a cause of worry because they are the future. This is the next generation. Absolutely. So we got to start early, and this whatever Pacific OneHealth is doing is looking also at school nutritional wellness programs, also looking at adolescents, the working class, also looking at corporate wellness workshops and programs. So the idea is to catch them early and to try everything that tool of clinical knowledge, biomarker readings, diagnostics, to come to a situation where you can actually stop the process of disease advancing and getting engulfed in it.
And there's a reason why is it called lifestyle management, lifestyle disease, and you've mentioned a lot of practices of an adolescent, which majorly talks about lifestyle. So do you also think that there should be major shift in lifestyle practices as well?
Because that's an excellent question. What happens is that it was lifestyle earlier. Lifestyle just meant 3 things. It meant diet, exercise, and probably sleep. Now it's lifestyle plus. You also incorporate the quality, duration of sleep, stress management, kind of exercise you need to do, how many minutes must you have a week, and the importance of strength training, importance of keeping your muscles intact, because suddenly after 30-40 your muscle mass starts going down, and that is something that adds to the process of disease. Then screen time, mobile phones, mindful eating, sitting together and eating and spending at least 15-20 minutes over lunch is a better option than just gulping down pizza and burgers in the next 5 minutes. I understand there's paucity of time, there's stress. Unless you take out time for yourself, then time's not going to wait for you. And disease is something that's always around the corner.
And that's how we play a very proactive role.
Which is why sleep modulation and putting your screens off, getting off your mobile phones I mean, 20 years ago, we didn't have a situation where we had a mobile phone in one hand and the remote of the TV on the other hand. And that's all that mattered in the last 1 or 2 hours till you went to sleep. So you disrupted your sleep pattern, your circadian rhythm, you added to your stress, and you're sleeping less. If you sleep less than 7 hours, then where does your body get time to repair itself? Sleep is so important, like hydration, adequate amount of water, to rejuvenate and reset you for the next day. So you're starting your day with fatigue, difficulty in getting out of bed, a bit of brain fog. So you without this handicap itself, don't create handicaps for yourself to be more productive.
So the hybrid model which you mentioned, combining technology and personal connection, seems like the sweet spot between scale and exclusivity. And one of the biggest pain points for patients has always been the long waits, as you mentioned, and lack of transparency. How do micro hospitals improve convenience and overall patient experience?
Because a sense of personalized care, building of trust, a continuous process, keeping their digital records and keeping them through the phone or the internet or the media or communications, advanced teleconsultations, a sense of continuity that the patient is the shared responsibility again. It's easier to do it in a microscopic or a mid-sized hospital than in large hospitals where they are always into acute emergencies which need to be addressed as a first priority to save lives. Whereas out here, in preventive and corporate wellness and school nutrition wellness, and working with communities close by, you're catering to a more compact society, and also keeping your public health responsibilities in mind. Technology enabled and using AI with not the institution at the center, but the patient at the center. Okay, that is very important. And understanding what is happening in the world, how to incorporate the best practices globally, it's far more easier if you're not overawed by large, glitzy, humongous spaces where you have ambulances coming in and out all the time and there's emergency acute situations all the time. So the patient is also more comfortable, he gets personalized care, there's a build-up of trust, he understands there will be continuity, and there will be the combination of trust, technology-driven, and a personalized sense of care. All these contribute a long way in understanding that mid-sized and microscopic hospitals, which are community-based, depending on personalized care, a continuous situation of monitoring, with a team of people who are available to reach out to you and vice versa, will go a long way in bridging the gap between large mega hospitals and smaller clinics.
So transparency, shorter queues and measurable outcomes, that's a welcome change, and it really puts patient at the center, as you said. Now shifting to the integrated and tech-enabled care, which is the model for Pacific OneHealth. It has built an integrated model which connects consultations, diagnostics, nutrition and even rehabilitation under one roof. How does this approach improve chronic care outcomes?
Yeah, because you're not working in different silos. You're working in a process which starts with your screenings, your blood biomarkers, your body metrics, your nutrition profile, your history of family disease. Everything gets incorporated and digitalized, and you have constant follow-ups with trust and a personal point of care. So that is a starting point. But obviously now there's so much technology happening, there's advanced diagnostics happening, which is becoming more reasonable. So obviously the integration of this is called integrative medicine. In the West they use the word functional medicine because they also use a lot of other interventions which are because if pharmaceutical medications were to be solving all the problems, disease wouldn't be rising so rapidly. Sure. The number of doctors might go up, but the pharma usage is also multiplying rapidly. That means there is a missing link. The missing link is lifestyle plus. So you got to incorporate that. So getting the right advice, mentorship, assessment, all this is a part of integrative medicine, which Pacific OneHealth is looking at because you have to reimagine and redefine a scientific, evidence-based assessment and treatment protocol which can actually help people stall. The whole idea is you don't want to spend so much time in a disease span. Okay? If you can improve your health span and be largely free of disease for 10, 20 years longer, then you're making life easier, because people in the 40s, 50s, when they get disease, when they get heart disease or strokes, which is happening quite rampantly, because certain
and early too.
Early onset cancer, early metabolic disease, all that is a reality of life today. So what happens then is that your best years of life, instead of looking after your own children, giving them the right education, doing things for them, is spent with a child in his prime, in his early teen years or college days, is spent on worrying about his own parents being unwell. Look at the emotional cost that and the havoc it plays in relationships also. So like the parents have to also understand how they need to do it for their children, and the children need to be healthy because they don't want their parents burdened with cost of hospitalization and repeated visits. And autoimmune disorders are rising very rapidly. Our own body, it's because there are now 30,000 new products in the last 20 years which our body did not recognize. All packaged foods was never there, so our body did not recognize. The packaged foods has coloring agents, flavoring agents, additives and emulsifiers. Now they disrupt your gut linings. Therefore, gut health, gut microbiome, these assessments are also very important if you're going to give integrated corrective wellness care. And Pacific OneHealth has full plans to use advanced diagnostics. Also, people who actually need the gut health and gut microbiome assessment, integrate all that, and probably you'll have far more scientific evidence-based treatment protocols to help mitigate and stall disease.
And with technology now enabling remote monitoring and home-based care, how is Pacific OneHealth helping patients take a more proactive role in managing their health? You've already mentioned that a patient plays a very proactive role in managing their health, but with enabling remote monitoring and home-based care, how is Pacific OneHealth enabling that?
Basically, the size, if you're microscopic or maybe even mid-size, you can see a larger number of patients. You can be within the community and with emergency medical records and stuff available, tech-enabled teleconsultations available, easier access, point of care of personalized care delivery. So all these combination of factors will help you keep track of something, those metrics of their symptoms, and the patients also understand that there's a continuous sense of approach. You're not fishing for different doctors to cure you, and you're not getting cured. So your chance of getting better, your chance of personalized care, your chance of a team of doctors, specialists, other technicians, diagnostic care under one roof, radiology care also available, and different departments taking care for you under one roof, which is accessible, which gives a sense of warmth rather than being overawed in a large glitzy building. So that it's also, there's a pretty common problem. A lot of patients, when they come to you, if they come to you, they see an unfriendly doctor, or they see an unfriendly environment, or they have that long wait, and you measure the BP, it'll be slightly higher. That because they already started with the anxiety trigger has already gone up.
The moment they enter.
Yeah. So that whole idea is to see them as they naturally would be in their natural environment, which is the comfortable. They feel a sense of belonging, and they know that there is somebody out there who's willing to look at all these things and not just give you a short shrift of time and just not prescribe, but talk to you about nutrition, diet, exercise, stress, sleep management. All these things need to be incorporated to give a sense of complete 360-degree insight, both for the clinician, for the doctors, for the team, and also for the patient to understand the importance of these factors.
So the exclusivity part of it gives the sense of belongingness to the patient. That's what you said.
Absolutely.
Now we move to the future of chronic care a decade ahead. So we're going to talk about the future now. How does integration of home-based care, technology, how does this, give us an outcome in let's say next 10 years? So how do you see chronic care evolving in next decade, and especially with rising lifestyle diseases and aging populations? It's a very important section of our community, the aging populations, and I think 70% of our population is the elders. And so how do you think that chronic care will evolve in next decade, and especially with the lifestyle diseases growing so rapidly?
Vijay, what you mentioned was 70%.
Yeah.
But that's why I want to, it's partially true and partially untrue. I'll tell you why. If you include the early onset of chronic diseases happening in youngsters, then the percentage goes to 70%.
Yeah.
Okay?
Yeah.
Because our demographic dividend is about a younger population that we have. But if the younger population is getting disease and chronic disease earlier, then their productivity level can't be a dividend. It becomes something to which can strain the resources of the country and the public health system. So what is very important is that precision-based medicine, preventive, which is predictable, which is available to you, accessible to you, and it's looking at the future advancements that are happening with AI, machine learning, and the research that's taking place in a lot of countries, including India. ICMR and various organizations are working very, very hard. Thankfully, we acknowledge technology, and the government of the day also, when we talk about millets, because the fact is the ancient grains are the ones which can give you far better health than refined flour and refined rice, because if you strip the food, basic carbohydrate of its fiber, then it's not a normal food. You moved away from natural sources of food and made it into a processed entity which your body then craves for, because you are also getting addictive to the refined starches, added sugars and sugary drinks. These are all addictive in nature, like tobacco and alcohol. This is also an addiction. So you got to protect yourself from the food industry, the pharma industry, and you got to be made aware. If you're with evidence, scientific backed, and if you start seeing better parameters, lowering trends, and you feel better, your sense of fatigue goes, and your deficiencies like the trifecta of serum iron, vitamin D3, and zinc and other micronutrients is covered up, you can sense the change, because we see it all the time. A lot of people in 4 weeks time, 6 weeks time say the pain is gone, you're feeling better, we're more active. It takes a bit longer, 3 to 6 months, to get all the parameters down to near normal, but you can't be suboptimal, because earlier, even something as important as the liver enzyme, one of the most important is a thing called SGPT. The reference range could be from 10 to 40 or 45. But you as a doctor, you got to, if it's going above 30, 32, then insulin resistance and the beginning of fatty liver has to be suspected. So you got to verify then whether he's actually a youngster or an adolescent or a teenager or a working class person or an elderly is getting fatty liver. Then that leads to metabolic dysfunctions further, downstream heart disease, gallbladder disease, impacts your cancer, because all disease now has to be looked at at cellular level. So I don't want to get too technical. There's a thing called glycation, methylation, membrane instability, mitochondrial dysfunction, the frequency of eating, insulin resistance, and inflammation. So most diseases start with inflammation. So inflammation can be defined as acute and chronic. Acute inflammation is where if I bang my knee out here, and the immune system will take over white blood cells, and they'll rush there, and if you get a nick in your hand or something, in 4 or 5 days time that it heals. Chronic inflammation is that you are constantly at low heat, organs of your body are under stress and inflammation. And we are just not a bunch of organs that we think we are. We are a network. Every organ is interconnected. The gut-brain axis is intact. The immune system is linked. Organs talk to each other. There is a sense of communication. So we don't try and just fix the organ. Try and fix the entire network which is inside, which is your entire blood vessels your vasculature, endothelium, gut microbiome. All this will go a long way in actually curing a person in a far shorter span of time, and they'll actually get relief.
That's a fascinating outlook. Finally, what role do you see Pacific OneHealth and micro hospitals, or Pacific OneHealth as the chain of micro hospitals, play in shaping the future?
I think Pacific OneHealth, the entire motto is primarily that you have to reimagine what chronic disease management and preventive management is all about. Unless you reimagine, because if we don't look at newer ways to give personalized patient care, then it's going to be one and the same thing. You have to reimagine by empowering people that the destiny of their health should be in their own hands, and they can actually do it along with sound advice and medical processes, wellness programs, wellness interventions, and focusing on nutrition, diet, healthcare, sleep, screen time, minimizing screen time. All these factors, along with biometrics and advanced micro-diagnostics, can actually mitigate and do justice to microscopic and mid-sized hospitals. So it is the future. This is where it's all headed. It's all headed. In US and UK, you have the concept of concierge doctors. The top doctors, actually, you don't get an appointment for 3 months, 6 months, so you're worried, and it's a cause of worry if you can't get an appointment. Out here, you can get appointments easily, and healthcare is available. So we've evolved faster, and you can get blood tests done over the phone, or 10 companies you can choose and get. But also, what is happening is precision pathological lab diagnostics is also something that one has to understand, that investing in new technology, in better reagents, in better diagnostics will give you far more accurate numbers. Unlike, if you're doing maybe 1,000 tests a day, then there's so much pressure on the pathologist and the system and the machines which give you these numbers. So there is a chance that some of the numbers may not really add up, because when you look at a result with 70, 80 parameters, you got to actually, it's like a jigsaw which you got to justify as to why you're writing down that you have insulin resistance or likely fatty liver, or if your uric acid is beyond a certain level. Some labs say up to 7.5 uric acid is all right. For gout, it could be that. But uric acid, if it's higher than 5.5 and 6, it does something called mitochondrial imbalance. And your mitochondria is something that converts food to energy. And you end up, if your mitochondria are under stress and not functioning properly, you start converting food to fat. Okay. The purpose of all food that we intake is to be converted into energy, so you can utilize to do various things like
be productive.
And every action that we do, thousands of reactions, chemical reactions. So you got to understand that we all have chemical cofactors, enzyme pathways, and different pathways of metabolism, absorption, digestion. So this awareness has to be given and shared with the patients also, so they understand how to have their relationship with food. Think about what to think of nutrition. How to read labels is a very important thing. How to read, like for something like sugar. We normally know there's glucose, fructose, sucrose, maybe lactose. But in the food industry, there are over 250 different names of sugars which we don't even know. So we don't even know the amount of added sugar that we are consuming in packaged foods, packaged cereals. So that is why this awareness is something which has to be integrated into the future. And Pacific OneHealth wants to do a comprehensive wellness, both for corporates, children, adolescents, and the elderly obviously deserve special attention, because they are the ones who culturally have ignored themselves for far too long. Because they've been so busy giving to their children and grandchildren, and they forget about themselves. It's the time to give something back to the parents and grandparents, because also now you have a thing called metabolic psychiatry. The entire spectrum of stress, ADHD in children, early onset dementia, Parkinson's, Alzheimer's. These are called neurodegenerative diseases. They are rising rampantly. And this is going to be a big problem. You can imagine something like having a parent there with you, and he gets dementia at 60 or 65. Earlier it should have happened much later. So if your parents does not able to recognize you once in a while, then you can imagine the kind of trauma you're going to suffer. So they are alive, but yet not alive enough to recognize you. So how do you mitigate these things? And there's a lot of research happening. There's liquid biopsies, there's CRISPR technology, there are proteomics, and there's protein measurements of various kinds, and certain new tests. You can have certain genetic predispositions to disease like Alzheimer's or something else, or cancers. But today there are solutions because you can reprogram your immune cells to target those things. So we are, like I said, the best of times are also around the corner, because there's technology which needs to be used for the advantage of mankind, and we can't ignore machine learning models, and there are a lot of top institutions doing spectacular work. We have to incorporate all those best features to give the best to our patients.
So awareness, diagnostics, patient-centric care, and I think all of this comes under Pacific OneHealth umbrella.
Well, all these contribute to empowering the patient first, giving him the personalized point of care that he needs, integrating trust technology to give a preventive, predictive situation where you actually get down to curing them or stalling the progress of chronic disease, so you have a healthier lifespan than just controlling disease and acute situations. And preventing hospitalizations should be a thing, because it really taxes the system. It has economic ramifications both for the individual's family and for the economics of a country.
So thank you so much, Dr. Ilmi, for sharing such insightful perspectives on chronic disease management, and how does micro hospitals plays an important role in that, also on preventive care, and which majorly transforms India's healthcare landscape altogether. So thank you so much.
My pleasure. Thank you for having me over. Thank you so much.
As we heard today, the future of healthcare is not just about treating illness. It's about building trust, using data smartly, and creating systems that make prevention a part of everyday life. If you enjoyed this episode, don't forget to follow the OneHealth Conversation, a podcast series powered by Pacific OneHealth, for more conversations with experts driving the next wave of healthcare innovation. Until next time, I am Vigya, your host. Stay healthy, stay proactive.